This second part of the lecture on the development of the pharyngeal arches will focus on the development of the face as well as the development of the tongue. We will also summarize the fate of the pharyngeal arches. In doing so, we will continue to discuss the following competencies and look at what the pharyngeal arches will develop into. Remember, the pharyngeal arches are on either side of the developing pharynx, which is the initial part of the foregut, just posterior to the structure called the stomadeum. There are 4 pharyngeal arches, and we're going to combine the 4th and the 6th and just call it the 4th arch. If we look into the stomadeum from this direction, this is what we would be able to see. We would see a frontal nasal prominence. We would see first arch structures, and there are 4 prominences we can identify here. And the prominences, all these 5 prominences, will all surround the stomadeum. An ectoderm of the stomadeum will continue all the way posteriorly to the tonsillar fossa. In addition, we want to acknowledge that neural crest cells are going to migrate into the pharyngeal arches, and that these crest cells are going to give rise to many of the skeletal structures in the region of the head and neck, including the bones of the face and some of the bones of the skull, and some of the cartilages found in the neck. In addition, the neural crest cells will give rise to dentin, tendons, dermis, meninges, the sensory neurons, and some of the glandular stroma. When we look at the development of the face, early on at about 5 weeks, we can see that there is a frontal nasal prominence, 2 maxillary prominences or processes, and 2 mandibular prominences or processes. These all surround the stomadeum. Below is the region where the heart develops. So by week 5, we're going to have these 5 prominences, and in addition to that, we're going to begin to get a thickening and invagination of the ectoderm in the region of the ventral forebrain. The ventral forebrain is going to induce this thickening of ectoderm and its invagination as the nasal placodes develop first, and they will give rise to the nasal pits. As the nasal pits invaginate inward, there is tissue on either side of those pits, and they will be called the medial nasal prominence in purple and the green lateral nasal prominence. You can see them in relationship to the maxillary prominences and the mandibular prominence below the stomadeum. Over the next 2 weeks, the medial nasal prominences are going to grow in size and migrate towards the midline. In addition, the maxillary processes are going to grow towards the midline as well, and they will also increase in size. The medial nasal processes are going to fuse in the midline, and as they fuse in the midline, they're going to give rise to part of the nose. The maxillary processes are also going to move towards the midline, and they're going to fuse with the medial nasal processes. The 2 medial nasal processes, here, fused, and the 2 maxillary prominences or processes all come together to form the upper lip, the upper jaw. If we look at the lateral nasal prominence it comes into contact with the maxillary prominences, and there's a separation there, which initially is a groove, and it's called the nasolacrimal groove. That groove is going to invaginate, eventually fuse, and form the nasolacrimal duct with the lacrimal sac in the region of the orbit. The mandibular prominences are going to fuse in the midline, and they're going to form the lower lip and the lower jaw. The mandibular processes fuse in the midline as a single structure, the lower jaw and the lower lip. The cheeks are going to develop from the maxillary prominences, as these maxillary prominences are going to give rise to the maxilla. So the maxillary prominences give rise to the maxilla, to the upper jaw, the upper teeth, except at the midline and the upper lip. When we look at the development of the nose is formed a little bit from the frontal prominence, that is the bridge of the nose. The medial nasal prominences fuse in the midline and form the crest and the tip of the nose, and the lateral nasal prominences will form the ala of the nose. Now, if we look at the medial nasal prominences, we talked about the two of them fusing in the midline and giving rise to the philtrum of the upper lip and the upper jaw component. And in terms of teeth, these would give rise to the four incisors. In addition, these two medial nasal prominences also form what is called the primary palate. So there's a palatal component then to the fusion of the medial nasal prominences. And all these structures together are considered the intermaxillary segment. So the intermaxillary segment is the fused nasomedial processes that give rise to the upper lip, the upper jaw, and the primary palate. The intermaxillary segment is going to fuse with the secondary palate, along with fusing with the maxilla. And that is how the upper lip, upper jaw, and palate are formed. The secondary palate is from two outgrowths of the maxillary processes. These outgrowths are called the palatine shelves. And as they grow towards the midline, they're going to fuse and form the secondary palate. If we look at this from the side in a sagittal section, what we can see is the following. That you're going to have the frontal nasal prominence. You see the nasal septum beginning to develop. You notice as we're just cutting through that intermaxillary segment here, as the palatine shelves have not reached the midline yet. Here we see the developing tongue. If we take a coronal section then, we should be able to see the two palatine shelves migrating towards the midline, and they will fuse with this nasal septum. So if we look from the front at this coronal section, we see the following. The nasal septum growing downward, the two palatine shelves growing towards the midline above the tongue and oral cavity. These will eventually fuse to form the palate and to separate out the two nasal cavities. So the palate is derived from the palatine shelves and the intermaxillary segment, and the junction between the two can be seen as the incisive foramen. One of the things to note is that the fusion of the intermaxillary segment with the palatine shelves occurs temporally at a different time than the fusion of the secondary palate. And so you can get a cleft lip, cleft jaw, cleft primary palate, or you can get a cleft secondary palate, or you can get both together. They don't necessarily have to occur together. As the palatine shelves fuse, as we said, they're going to fuse with the nasal septum. When we look at the development of the tongue now, we can see that the tongue develops where the pharynx and the stomadeum meet. We can go back and look at our arches here, 1, 2, 3, and 4, and see how they contribute to the tongue. The first arch has 3 swellings that occur, one in the midline called the tuberculum impar, and 2 lateral swellings called the lingual swellings. The second, third, and the fourth arches are going to contribute to a swelling called the hypobranchial eminence, or copula. An epiglottic swelling develops in the region of the posterior part of the fourth arch. The lateral lingual swellings from the first arch are going to give rise to the mucosa of the anterior 2/3 of the tongue, back to the region of the foramen cecum. The hypobranchial eminence is mostly going to be derived from the third arch, and that's going to give rise to the posterior third of the tongue, except for the most posterior portion, which arises from the fourth arch. And so the epiglottis and the very posterior part of the tongue are derived from the fourth arch. You can see that there's very little contribution from the second arch. When we look at the muscle of the tongue, we note that the muscle cells migrate to the tongue from the occipital somites. And those muscle cells, or myoblasts, are innervated by nerves that will go on to form the hypoglossal nerve. So if we summarize the development of the tongue, we can see that the first arch gives rise to lingual swellings, which gives rise to the mucosa over the anterior 2/3 of the tongue, and that mucosa is innervated by cranial nerve 5. The second arch makes very little contribution to the tongue. The third arch gives rise to most of that hypobranchial eminence, and it gives rise to the mucosa over the posterior third of the tongue, which is innervated by cranial nerve 9. The fourth arch gives rise to a little bit of the hypobranchial eminence plus the epiglottis, and the fourth arch is going to contribute to the mucosa over the posterior part of the tongue and the epiglottis. It is innervated by cranial nerve 10. The occipital somites give rise to the muscle cells that form the tongue muscles, and they are innervated by cranial nerve 12. If we go back to the nasal cavity then, we can remember that the nasal pits began to form, and as they did, an oral nasal membrane forms. This will eventually be broken through so that the nasal cavity will be continuous with the oral cavity and the nasopharynx via the primitive choana. Then, with the formation of the secondary palate, the definitive choana develop, so the nasal cavity communicate with the nasopharynx via the definitive choana. And the nasal cavity is separated from the oral cavity by the by the hard and soft palate. In the roof of the nasal cavity, there is an invagination that occurs, and this invagination is called Rathke's pouch. It invaginates up towards a downgrowth from the forebrain called the infundibulum. These two will fuse and will form the pituitary. The infundibulum is going to give rise to the infundibular stalk and the pars nervosa of the pituitary. And the Rathke's pouch is going to give rise to the pars intermedia, pars distalis, and pars tuberalis of the pituitary. If we then summarize what we've talked about in these two lectures, we point out that the surface ectoderm of the first arch gives rise to the epithelium of the buccal cavity, jaws, body of the external auditory meatus, tympanic membrane, the outside of it. The neural ectoderm gives rise to cranial nerve 5, the both maxillary mandibular portions. The skeleton gives rise to the maxillary mandibular bones via migration of neural crest cells, as well as gives rise to the Meckel's cartilage, which will develop into the malleus, incus, and the sphenomandibular ligament. The muscles that develop in the first arch are all innervated by cranial nerve 5. They're the muscles of mastication, plus 4 others, the anterior belly digastric, tensor tympani, tensor veli palatini, and the mylohyoid. As we said, the endoderm of the floor forms some of the anterior 2/3 of the tongue, and the first pouch forms the auditory tube, as well as the middle ear cavity. The second arch is innervated by cranial nerve 7, has very little surface ectoderm component. The muscles that are found in the second arch are all the muscles of facial expression, plus 3, the stapedius, the stylohyoid, and the posterior belly digastric. The endoderm of the floor is going to form the thyroid gland, and the pouch associated with the second arch, the second pouch, gives rise to the stroma of the palatine tonsil. The skeleton is going to give rise to the stapes, the styloid process, and some of the hyoid and the stylohyoid ligament. The surface ectoderm of the third arch, again, is not that significant. The third arch is innervated by cranial nerve 9. The aortic arches contribute to the carotid system. The skeleton contributes to the hyoid bone. The muscles associated with the third arch are the stylopharyngeus. The endoderm of the floor gives rise to the posterior third of the tongue mucosa, and the pouches associated with the third pouches give rise to the inferior parathyroids and the thymus. The fourth, and maybe fifth and sixth, depending on how you want to define it, arch is innervated by cranial nerve 10, maybe a little bit of cranial nerve 11. The skeleton is the laryngeal cartilages. The muscles are the muscles of the pharynx and larynx. The endoderm gives rise to the very posterior region of the tongue and the epiglottis and the pharynx. The pouches give rise to, the fourth pouch gives rise to the dorsal or superior parathyroids and the ultimo branchial body. Thus, if you know the embryology of the pharyngeal arches, you'll find the gross anatomy of this region fairly easy to understand.